Hello everyone, welcome to MedVision. In this video, we are going to explore the basic anatomy of a pelvic X-ray in a systematic and a professional way. This explanation will help a medical student and a healthcare professional learn how to read and interpret pelvic X-ray anatomy in a clear step-by-step sequence. So without further delay, let's begin our journey into a radiological anatomy of the pelvic. In this radiograph, we are observing the AP view of pelvis, which demonstrates the bony pelvis along with the proximal femur and the sacrum. First, we start from iliac crest. Starting from the cephalic, the most superior border of a pelvic, is the iliac crest. Iliac crest is a superior margin of the ilium bone and extending anterior to posterior aspect of the pelvis. It forms the upper boundary of a pelvic girdle and serve as important attachment for abdominal muscles such as external obliques, internal obliques, and transverse abdominis. Below the iliac crest lies the ilium, which is the largest and the superior component of the hip bone. The ilium form a broad iliac wing and contribute to lateral wall of the pelvis. Medially, it articulates with the sacrum at sacroiliac joint, form a sacroiliac joint, which is visible as a vertical joint space between the sacrum and the ilium. Moving the anterior and inferior along with the iliac crest, and we reach the anterior superior iliac spine. The ASIS is a prominent bony projection located at the anterior end of the iliac crest. It shows the attachment of sartorius muscle and inguinal ligament. Just inferior to ASIS lies the anterior inferior iliac spine. Just to lie down. This is the bony projection attached for rectus femoris muscle, which is a part of a quadriceps femoris group and contribute to hip flexion and knee extension. Continue inferiorly with reach at the acetabulum. Acetabulum is a cup-shaped socket-formed fusion of three pelvic bones, that is ilium, ischium, or pubis. The acetabulum appear as a circular in shape and form the socket of the hip joint and articulate with femoral head and form a hip joint. In femoral head within the acetabulum lies the femoral head, which is a spherical proximal portion of the femur, and make a ball and socket joint. We allow a multi-directional movements. Inside the femoral head, you see a small depression. A small depression seen, known as a fovea cupitus, can be sometimes can be identified with a attachment of a ligamentum aries. Just inferior to the femoral head, it connects with the femoral neck. That is called femoral neck. And this form in angle is called neck shaft angle. Typically is around 125 degree in adult. Here we move. Later to the femoral neck is a greater trochanter. That is a part of a greater trochanter. It is a large bony prominence that serves as attachment of several hip abductor and rotators, including gluteus medius, gluteus minimus, and piriformis muscle. And slightly medially and slightly inferior, the femoral neck lies a lesser trochanter. It is a small bony projection serves as the insertion point of a iliopsoas muscle, which is a primary hip flexor. If moving inferior, we are moving on the shaft of femur. If we are moving medially and inferiorly, that part is called the ischium, which forms the posterior inferior part of the hip bone. In the medial side, the sharp projection extending from the ischium is called ischial spine. This is a structure and it separates the greater sciatic nodes from the lesser sciatic nodes and serve attachment site for the sacrospinous ligament. If we move inferiorly, we observe the ischial tuberosity, which is a large roughened area commonly known as a sit bone. It bears body weight during sitting and provides attachment for the hamstring muscle. The next part is pubis. Pubis anteriorly in a pelvic ring lies pubis, which forms the anterior-inferior part of a hip bone. Anterior-inferior part of the hip bone. It consists of superior pubic rami and the inferior pubic rami. This rami contributes to the formation of a pelvic ring. We move at the midline, both pubic bone are made its core pubic symphysis. This is a fibrocartilage joint which connects the left and right pubis and allow minimal movement for pelvic stability. And between the pubis and the ischium lies the obturator foramen, which is the largest ovule opening for a opening in a pelvic. It is mostly covered with the obturator membrane and leaving with a small canal for the obturator nerves and the vessels. If we talking about the posterior midline of the pelvis and a bat wing-like appearance, it's called sacrum. The sacrum is composed of few vertebrae S1 to S5. As we talked in our previous time, the sacrum articulates laterally with ilium at the sacroiliac joint and form posterior wall of the pelvic cavity. Superiorly, the sacrum articulates with the lumbar spine at the lumbosacral junction, typically the L5 and S1. This region is important in load transmission between the spine and the pelvis. And the last part, the most inferior end of a vertebral column, lies the coccyx, also known as the tailbone. It represents the terminal segments of the spine and provide attachment of the pelvic floor muscles and ligaments. And what the last point is, the above or superiorly from sacrum, the part lies the L5 vertebra. That is a spinous process of L5, transverse process of L5. We are discussing about them briefly in lumbar X-ray in next video. So this was the basic radiograph anatomy of a pelvic X-ray in APU, explaining in a systematic manner. I hope this video helped you understand how to approach and analyze pelvic X-ray anatomy in a simple and structural manner. Thank you for watching. See you in next video.